We'll go ahead and go to Dr. Kong. If you just want to give us a little information about kind of what your thoughts are about what you've seen so far this flu season.
Hey everyone, so I'm Michele Kong. I'm one of the pediatrician and pediatric intensivists at Children's of Alabama. And in the last several weeks, we have really been seeing an unprecedented number of visits to our emergency room, as well as admissions to the hospital secondary to influenza or the flu. In the ICU, it's been pretty high in terms of the number of patients that we are admitting with flu, and not just that, the disease severity is significant. I think what is important to know that influenza is a super common viral infection that affects children, and although it can range from mild to whether it's coughing, congestion, runny nose, fever, it can really also lead to disease severity that is that what we're seeing right now is pretty unprecedented. We're seeing really a surge of patients who've been requiring intensive respiratory support, requiring the mechanical ventilator, and even developing multi-organ system failure. And I think what's important and critical to know is that for parents and for the community, that we have something in our toolbox that can really prevent and protect our children against the flu. And this is the flu vaccination. We have seen that it prevents it, and it also reduces the risk for life-threatening influenza and flu-related hospitalization, as well as emergency visits.
Okay, thanks a lot, Dr. Kong. No questions in the chat so far, but I do have a few things that we can talk about. I know, when it comes to getting flu vaccines, parents have a lot of questions about that. One of the ones that continues to come up over and over is the flu vaccine and the COVID vaccine. Is it okay for a child to get those together?
Absolutely. You absolutely can get them together. Sometimes after the vaccination, you may have a little bit of a soreness where the injection was, where you had the injection, or you might have, some low-grade fever and some myalgia related to it. But you can take your, Motrin or Tylenol, and I think that it is absolutely important and critical that we encourage families and parents to go out and obtain the vaccinations.
Any advice that you would have for a parent on talking to their child about getting that vaccination?
Yeah, so that's really an important question. I think the key in talking to the child is helping them understand why this is so important. Nobody likes a shot, adults don't like shots, and kids certainly don't like to get, injections. But I think it's really impressing upon them that, this is the one thing that we can do that will prevent them from getting the flu. And even if they do get the flu after the vaccination, we know that it makes them to be more protected against disease severity, meaning the chances of them actually needing to be hospitalized or, developing more severe flu symptom is going to be less. So I think it's really sort of, telling that to them in a language that they understand. What I've also seen to be very helpful is creating something called social stories, where you can, write down the narrative of why a flu vaccine may be important, what it looks like to be sick in very concrete, languages, and read that to the child, and that can be helpful. And I think also, having them be, talking about it even in schools, in classrooms, and with the peers is also an important thing.
Okay, we do have some questions now. We have a question about age ranges of patients that's we don't have those kind of specifics right now. So I will refer you to the ADPH details as far as any numbers go. Allie Root from CVS 42 wants to know, what kind of impact does the unprecedented flu visits to the ER have on ER and patients, and in terms of wait times? Can we talk a little bit about, how this is affecting the emergency department as a whole? I know, I don't know how much detail you can go into about that, but can you speak to that in general?
I mean, I think the volume in itself has been staggering, because it's not just the influenza, it's also RSV. and other very common respiratory viruses that we are seeing a lot of now, more so than we've ever seen pre-pandemic. And so, as you might imagine, if all these children come to the emergency room, then it can really overwhelm sort of our system as well. And it really boils down to, at that point, for us to do a really good job at triaging, making sure that we see patients who needs to be seen immediately and provided with the medical help that they need, versus those who can perhaps, have a little bit more time. I think what's important for families is also to have sort of a discerning approach to when to take their child to the emergency room versus the urgent care or versus their pediatrician, because again, the symptomology can be pretty varied. You can have, mild cough, URS symptoms, you can have fever, child may not feel very well, may not want to eat or drink. But if they're still able to, the color looks good, their mentation looks good, they're still eating and drinking, and, perhaps, and they're still making good urine or having good urine output, then perhaps the approach is to go to the urgent care or to the pediatrician versus to the emergency room. The times that you must absolutely come to the emergency room would be if you're at a point where you're seeing that, you have increased work of breathing, your child is having retractions in your chest or head bobbing or, nasal flaring, or let's say their mental status is not as good, they're significantly more sleepy, they're not able to keep down any food or drink, they're not making urine, or they have very, very high fever. I think these are times, and these are sort of red flags that, you have to immediately seek help. So certainly, I think as a whole, just with all the different viruses, in addition to flu that we are seeing in our community now, our healthcare system is certainly getting inundated, and it becomes a real challenge.
So I know obviously we're speaking, more so about flu than anything else today, but obviously RSV, COVID, still concerns. Can you talk in general about those three together? And, and you may have hit on this a little just there, but how challenging that is to deal with and the effect that that's having?
Yeah, I think the challenge from a parent standpoint is that they can look very similar. The symptoms can look very similar between RSV, influenza, and COVID, at least in the initial part. And sometimes, so at that point, it really just again falls to, looking at how the disease severity is and what the child looks like and helping decide, where to go. But I think for us as a health community or a medical community, it's been incredibly challenging because if you think about it, pre-pandemic, we typically historically would see RSV or influenza sort of during the end of fall, winter season. But during the pandemic in 2020, we basically saw zero RSV or influenza for that matter. And a lot of that is in part due to all the things that we were doing because we were in the pandemic with, socially isolating, schools were closed and so forth. And so I think, in part because the babies who were born at that point, in 2020, who are 2-year-old now, or who the 1-year-old, their immunity is a little bit different because they haven't been exposed to RSV or flu or adenovirus, rhinovirus, all these different viruses. And so now that we are sort of how we are pre-pandemic, all of a sudden they are having their first RSV, their first flu, first rhinovirus, and all of them, and really just and COVID is still around too, and really, all coming at the same time. We started seeing RSV, for instance, even in the summer month, which is very atypical for here. And it's going to remain. It remains to be seen, what that viral profile is going to look like from here on out. But as of right now, I think, it is just key that whatever we can do to mitigate this, to prevent this, we need to do it. In terms of treatment for these viruses, oftentimes it is symptomatic, meaning if you need fluid, we give you IV fluid. You need breathing support, we give you oxygen. We give you, we put you on respiratory support, and we support your organs, but there is no specific treatment per se, at least not when it comes to, RSV, adenovirus, rhinovirus, and things like that. With influenza, if we know that you have influenza or we have a high suspicion of influenza and you're hospitalized and you're pretty sick, then there is an antiviral that can be given to the children. And I think more important than that, again, goes back to the role that vaccination plays, because this is the one thing that we have that can prevent the flu infection. And even if you do get it, prevents disease severity.
So there's a question about, the length of stay for patients. Generally speaking, are we seeing some patients that are having these longer stays, or most of them shorter stays? Or are we seeing kind of a mix of both?
Yeah, so I think, lately what we've been seeing are patients who are very sick from influenza. And typically with viral illnesses, your length of stay is generally in the sort of couple days range if you're admitted. If you're in ICU, it's also usually a couple days. But what we've been seeing lately has been kids who have really multi-organ system failure, on a lot of support, whether it's from the breathing machine or support for the other organs. And so with that, the length of stay is going to be much longer for these children. So the sicker they are, the longer that they stay. We're also seeing kids who have, infection that, from influenza that infects their spinal cord fluid in their brain. And so that also is very concerning as well.
Taking a look at the flu vaccine again, I know another question that comes up for parents a lot is, will the flu vaccine make a child sick? What can you tell them about that?
So the flu vaccine in itself doesn't make you sick, not in that sense of the word. You may feel a little bit unwell after you get it, where you might have some soreness in your arm, or you don't feel as good, but it doesn't make you sick where it leads to an admission to the hospital or something like that.
We have a question about multi-system organ failure for admitted patients. Is this something that we're seeing anything of or a lot of right now?
Yeah, this is certainly something that we're seeing in our ICU right now. The child comes in having increased work of breathing and requiring intubation and support from the mechanical ventilator. But we're also seeing kidneys failing, heart failing, and like I alluded to before, the brain sort of failing, where we really have to sort of take over and provide support for all these organs. And again, one of the challenges that with a lot of these viruses, the treatment is supportive care. And that's why it goes back to, if there's something that we can do to prevent it that can decrease the disease severity, then we should absolutely do that.
And I know the vaccine is certainly something that can help. What about general health practices, just proper hygiene? Can you talk a little bit about the importance of that?
Absolutely. So I think if you are sick, don't go out, stay at home. And certainly if you have a child who is getting sick or is sick, I would certainly avoid large crowds. Good hand hygiene is good. I think, all the practices that we've done during the COVID pandemic, it applies to the situation that we're in now. Because think about it, when we were doing all those mitigation strategies, we didn't see any RSV, we didn't see any flu. And so those strategies work. I think at this point, it's a matter of sort of finding the balance of how do we keep our school opens, how do we, continue with what we're doing, but at the same time, be very safe and prevent this sort of triple insult that we're getting from our RSV, influenza, and COVID.
A follow-up on the multi-system organ failure question. Is that something that's new for the flu this time of year? Are we seeing more of it than we have in the past?
It's not something that's new for influenza, in that it's something that's been reported. We've seen it before. I think what's been different in the last couple of weeks that been scary and really intense for all of us in the ICU is that we're seeing a lot more of it. And to me, that's sort of the part that is, really scary.
What about COVID and the flu at the same time? Is that even possible for a child to have both of those concurrently?
Yeah, absolutely. We've had children with 2 or 3 viruses at the same time. And of course, if you do have multiple viruses, your risk of having more severe disease, again, is going to be heightened.
Do you happen to know why we're seeing more of the organ failure, the multi-system type organ failure, and not just specifically that, but why is the flu season more severe this time around?
That's a really good question. And, I think it's probably a multifactorial reason. I think, one of it is going to be the fact that our immunity, at least for our kids who are, less than 2, is going to be a little bit different because they were born and raised in the 2 years of sort of when we were dealing with the COVID. And so, I imagine their immune system is going to be different because the exposure was different. So I think that's certainly it. It will, with time, we will know sort of what strain that we're dealing with, the virulence of the strain. This is something that is actively ongoing in terms of investigation so that we, know a little bit more about that. But I think certainly having gone through the COVID pandemic is a contributor to, what we're seeing. That's a change in the immunity of our children right now.
What kind of treatment options are there for people who are having these more severe cases?
The treatment is supportive. And so again, that means, depending on whatever organ is failing, that's the organ that we support. A lot of times for this baby, so for babies, for instance, a lot of times what they'll come in with is respiratory failure. And we can rescue that by way of providing high flow nasal cannula, which is a method of delivering oxygen with a sort of positive pressure, or if we escalate, it goes to non-invasive ventilation with BiPAP, CPAP, or if it becomes worse, then we sometimes need to put them on the breathing machine and they're on the mechanical ventilator. We've also had children who, despite all these effort, ended up needing to be rescued with ECMO, which is a heart-lung bypass machine. And so really all that we can do for viral infections such as these is really support the organs and wait for the body to sort of fight the virus and in the meantime preventing secondary complications, whether it's bacterial infections or secondary bacterial infections or things like that. With influenza, it's a little bit different in that we do have Tamiflu, and so that's something that we can use and often use to treat when our kids are in the hospital or in the ICU. And likewise with COVID, we have a specific protocol that we use, whether it includes the antiviral therapy or other immune modulators that we use. But those are the two that we can actually sort of treat and do something for. With RSV and the other viruses, it's really just supportive care at the moment.
So I think I believe we've answered all the questions that we can answer. There's some numbers related questions that we just don't have data that we can share right now. There's an amoxicillin question. We can't address that right now, but we do have a statement that we can send. Allie, I see that question from you. We can send that to you as soon as we're done. I believe that is. I don't know that I have any more questions. Dr. Kong, is there anything else that you feel like that needs to be addressed related to the flu that you haven't talked about? Anything that parents need to know, as we kind of progress through this very difficult flu season?
Yeah, I think at the end of the, I think the bottom line is know that influenza is very common right now. We're seeing a lot of it. The symptoms can range from mild to severe, and keep a close eye on the child. If you haven't vaccinated your child yet, please do get the vaccine because it can prevent the flu, and not just prevent the flu, but protect against the flu from the child having more significant disease. I think also be smart in sort of, when the child is sick, making sure that they stay well hydrated, control the temperature. And if there's any signs that things are getting worse, and certainly seek medical care.
All right. Well, I think that covers it pretty well in terms of what we're seeing here at Children's of Alabama this flu season. As you heard Dr. Kong talking about, some of, what's leading to, some of these severe cases and different things like that. More than anything, we want to kind of provide information for people, let people know what's going on, and let people know about the strategies that parents can take to make sure that their kids will stay safe. If you have any other information that you want to ask about, or any follow-up questions, feel free to reach out to us. The best way to reach out to us is through the media line, 205-800-4052. That's always the best and quickest way to get in touch with us. But aside from that, and Allie, I see your email there, aroot@cbs42.com. We'll make sure to send you that amoxicillin statement. Thanks for joining us, and everyone have a nice day.